So you've taken the plunge, you've just had your surgery, you're coming out of the operating room into the recovery room. What does it feel like from the beginning? Initially, when you hit the recovery room, you're going to be sleepy, so you're not going to feel anything. But as you start to wake up, there are a few different sensations that you may or may not have, and every patient's a little different. Some patients experience a tightness in the chest because when we're placing a breast implant, we're placing it usually behind the muscle of your chest wall, creating a new space, so there's a tension, a pressure underneath there. Sometimes there's a soreness, like you've had a workout or pulled a muscle. Some patients feel absolutely no pain at all, and the experience is very variable from patient to patient. All of these, however, are normal. Any one of these sensations is acceptable. We try to make sure in the recovery room that we assess you for alertness, that everything seems to be healing well, that there are no complications, and then managing your discomfort. Sometimes no pain medications are needed. Sometimes Tylenol by mouth. Sometimes you need some IV medication and then some PO medications that are narcotic in nature to control your pain, as pain is a very subjective experience. Following the procedure, the key is really to recover well. You want to keep your hands between your shoulders and hip height. So this is the safe area where you're not engaging the pectoralis muscle that we place the implant underneath. And the mistakes people make are they'll slam a door for the car shut or try to pull the door to the refrigerator or something open, which uses the muscle, which can be very painful to you. Sharp movement of the muscle after you've placed the implant beneath it can actually result in a tear of the muscle, which can create bleeding and a bad complication. So you want to be very cautious not to do so. If you want to be super safe, if you keep your elbows against the side of your body and move your body like this, you're using your biceps, you're not using your chest muscle. And by keeping your elbow next to your side, no matter what you do with your hands, you're not going to hurt your results. After the first few days, you might have the soreness, you might experience bruising. The bruising tends to be seen underneath the fold of the breast, or the sides, underneath when you're standing up for gravity. On the sides, when you're lying down in your bed, it kind of collects underneath the arms and the armpits. So that bruising is normal. Over time, the breasts feel a little stiff initially. They tend to settle down. Your body gets used to them. Usually by 2 weeks, you'll be able to drive and do most normal things except for heavy lifting. Little by little, we'll let you know at each visit what you can and can't do. By the time you get to 3 months, you'll be off of all restrictions, limitations, and you should be able to do all that you want to do.